welcome back to my YouTube channel. So for the last 6 months, skincare has been one of the biggest topics for you guys for asking me questions. The biggest topic on my social media. I've been seeing Suzette now for probably 3 years. 3 years. So here's a little photo of my skin the first time I went to see her. And then this is my skin now. So I don't have any makeup on, nothing. So Suzette truly has done absolute wonders for my skin. Like I said, you guys have had tons of questions. So I figured it'd be best if we just sit down with Suzette, the skincare professional, ask her questions, and then you guys can get some answers that you want. But before we get started, I will put, as always, her Instagram handle for Kelowna Medical Aesthetics right here, and then as well as her website right here. So yeah, I guess we will just dive right in, or should we, yeah, why don't you tell me just a little bit about yourself and how you got into skincare? I know you were a nurse.
Yeah, I've been a nurse for 30 years, and I've been in skincare for over 20 years. I've owned several businesses, skincare businesses, and I've just interviewed just thousands of women throughout the years, and just what works, what's working for them, what's not working, and just really very passionate about skin, for sure.
And she's really good at what she does. Really good.
Thank you.
Okay, so let's just dive in. I'm gonna read your guys' questions and Suzette's gonna answer them for you. So here we go. Okay, first question. What treatments are recommended and are safe for pregnant women?
All right, so being a nurse for 30 years, and I specialized in maternity, so this is a very heartfelt area of mine. You need to be very cautious in pregnancy, and either your doctor or nurse needs to know that certain treatments are not recommended. Laser treatments, hair removal are considered safe, but should not be done throughout pregnancy. Treatments like a facial definitely can be done through pregnancy. As our hormones fluctuate, we usually do end up with a few skin conditions, breakouts throughout the pregnancy. So actually a facial is just a wonderful treatment for our pregnant moms. Not such a bad thing to have. We do steam exfoliation, we do mask, and half of it's massage, so the baby will thank you.
The facials are amazing.
So it's kind of a detox for your face at a great time. So the second treatment I would recommend throughout facials would be dermaplaning, would be nice. As the hormones fluctuate, we sometimes increase the vellus hair in our face. And so by removing that vellus hair, the peach fuzz also called, we use a sharp instrument to remove that, and it also removes the epithelial epidermis outer layer of deep cells, old cells, and does a beautiful exfoliation, and so that your skin is left soft, like a baby. So. Yeah, those are the two treatments that I definitely recommend.
And then, so microneedling you can't do either then when you're pregnant, right?
Again, safe treatment, but we want to err on the side of caution.
Yeah, okay, perfect. Okay, and then another one is, what's recommended for a morning skin routine? I've been told just toner, not cleanser.
Yeah, so through the night, you don't need to cleanse again in the morning, as you didn't put makeup on through the night. You've already cleansed in the evening. So what I want you to do is just basically cleanse your skin. Use cold water, just splash cold water. We don't need to cleanse again in the morning. Over cleansing can actually create more oil, sebum. So we only want to cleanse once a day, and that's done at nighttime. In the morning, all we want to do is use cold water, and then we use our toner. So either toner pads or the little liquid toner, and then we would go ahead and proceed with our moisture, SPF, and makeup.
Yeah, that's what I do now, and cold water. Even listening, so if you guys go to Kelowna Medical Aesthetics on Instagram, Suzette was just traveling throughout Europe, and you interviewed tons of women out there about their skin, because they all have beautiful skin, and everybody said drinking lots of water, and they wash their face with cold water. Because I used to wash my face with hot water, and my skin was so red, so irritated all the time, where as soon as I switched to cold water, it honestly, just doing that made such a huge difference.
Well, and it takes a little bit to get used to, especially in the winter.
But now I'm fine. At first I was like, this is so hard to do, but I don't know, after a few weeks, it just, you kind of get used to it.
Well, it's refreshing. In the morning, I can't even wait to get up to Ashley Splash with cold water. It's beautiful.
I know, it wakes me up. It's really
keeps
nice.
the pores nice and closed, the redness down, and keeps your natural oils in.
And even because my fiance Jared came in, and he would get a lot of blackheads on his nose from hockey, because after hockey they would have a hot shower, and then he's getting like sweat and dirt and all that stuff in it, and ever since he switched to cold water, it's helped with the pores on his nose.
Wonderful. And even just your shower at the end, just splash with cold water. It actually boosts your immune system, and people get back acne, so again, it'll seal those pores in your back.
Okay, Next question. So I've had a lot of questions about the dermaplaning and how it actually has helped my acne. So the question is, how does peach fuzz relate to cystic acne?
Well, the peach fuzz, also called the vellus hair, can create sweat, debris, not germs, but almost like a bacteria on the face, and it can create, it can increase the sweat glands. So as we sweat, by removing the hair, which would be through our dermaplaning, it would remove, the dead skin cells, the dirt, the impurities, and it would refresh the new cells. So that's decreasing the acne, cystic acne. So when you're now putting on, as we scrape the epithelial cells, we take off layers and layers of dead skin cells, so it refreshes the skin. So when you go to put your creams and toners and serums, it's sitting now right on the skin, and your skin is baby soft. Right? So
and
now
your makeup goes on so nice.
And it just penetrates so much nicer. So when you're going to put the toner, which helps neutralize the skin, it will help with decreasing your acne, the cysts, and it just works a lot better.
And I know a lot of people ask too, because they're worried like, oh, does your hair grow back thicker or longer? I've been getting dermaplaning done now for, I don't know, quite a while, and it's the same.
It is.
Yeah.
And, really legit questions.
Yeah.
So we're just scraping from the top. And so we're not touching the root. We are not, waxing. We're not using threading. So it's not taking out the root. We're just scraping from the top. So if we did a treatment and we did not do a treatment for 6 months, it'd be the exact same amount. People that come on a regular basis, it is usually less and less, the vellus hair. But it definitely does not make it thicker.
Okay, next question. What everyday routine can I do to maintain the elasticity of my skin and prevent sagging?
Okay, so good question. The big thing when I did travel throughout Europe, most people were saying that a really good skincare regime was important to them. So cleansing, toning, moisturizing, and even when you're putting your creams on, massaging under the bones.
Yes, one of the girls was talking about that. I remember hearing that.
Yeah, so massaging underneath there, it almost does a bit of a detox, but it actually builds collagen, strengthens the muscles. So you'll see after you've had a facial that you're radiant, you're plump, you're firm. And usually it's like the red carpet. So a lot of people that go to these fancy events have an Ace facial and they just look radiant. So it builds that muscle. So we want to make sure that we decrease our stress. Stress produces hormones that can, affect our collagen level. We also want to get our beauty rest. Stay hydrated is a big one to keep that going. No smoking, decreased alcohol seems to be, help as well. Exercises increases the exercising on a regular basis increases the oxygen to the cells, and so that's really important. Also trying supplements also really helps build that elastin. So a lot of damage is caused to the elastin comes from free radicals. Okay, so we really want to incorporate antioxidant supplements. So stuff like vitamin A, C, E, beta carotene is really important, and foods like green tea. We can also make sure we include Brazil nuts, which is actually amazing.
I love Brazil nuts. You're supposed to eat like 1 or 2 a day, right?
They increase elastin, so that's amazing. Zinc, salmon, protein, so that's really important. So that's just a little bit of, ideas that would increase naturally your elastin.
Okay, that's good to know. One of the questions actually for me was what I did to change for food and stuff after seeing you two, so I will touch on that later. And then another one is, how to manage breakouts and get through them ASAP. I can vouch for what she's about to say because I just had 2 little pimples here and they were gone ASAP with what she's about to say.
If I had to do something quick, it would be a toner. It's got usually glycolic acid in it.
So I use a toner morning and night, obviously, like Suzette was saying, in the morning, cold water toner. So I use Zoe morning and night. It's the only thing I use, and it's my holy grail. I love all of their products. I probably use 8 of them. But so toner morning and night, but if you're looking for something more intense, my sister, who's 16, so she's going through that hormonal acne, she was using the acne treatment pads, and those helped her tremendously. And so I noticed too, if I have a big one, sometimes what even my mom and I will do too is we'll wipe our faces with it, and we'll actually hold it on the pimple for a little bit. and it'll completely dry it up, so we'll hold it there, and then we'll also use the sulfur mask. So I've talked about that face mask, that you can use it as a whole face mask, or you can use it as a spot treatment at night. So I've talked about this one before, and this one right here, it's quite red because redness takes a while to go down, but it was a cystic pimple. I used the exfoliating polish by Zoe, then I put the toner pad on it and held it there, and then did the sulfur mask, and by morning it was reduced significantly, and then I did it the second night, third night, and it was gone. And usually cystic acne lasts, I don't know, 5 to 10 days at least.
It's
Like
deep.
it lasts so long.
That
So-
definitely would be number one, would be
Yeah.
go into the toning pads.
Yeah.
So it actually dries up before it actually comes to
A head, yeah.
right? But again, it's a bit more complicated than that. It's just not, that's your ASAP emergency.
Yeah.
But you really want to make sure that, you know, with acne, that we are looking at the whole picture. We want good cleansers, we want good toners, we want to make sure that
Treatments.
we wash our hands, that our
Yeah.
phone is clean
Our
with
phone, yeah.
rubbing alcohol, that our keyboards are rubbed with rubbing alcohol cleaned off. You know, keeping speakerphone more away from the face.
Yeah.
I can tell a lot of my clients where they break out on the one side of their face that
Yeah.
it's,
From holding your phone.
the phone
right
hasn't
here.
been clean.
Yeah.
Their makeup brushes is another thing. We want to make sure we're washing our makeup brushes with the cleanser that we use for our face, right?
I'm doing that.
And then spray with rubbing alcohol. Just kills
Yeah.
every last bit of bacteria.
Yeah.
So I tell a lot of my clients, if you've never cleaned your brushes, you need to throw those away.
Yeah. Also, pillowcases. Switching to, so what, there was a brand you said that's like a huge cause for acne. So I switched to an organic detergent
Yeah.
and double washed them, and that
Exactly.
helped a lot too.
Yeah, and a lot of people are using pretty harsh chemicals in
Yeah.
laundry, so use one that's for sensitive skin, and always do a double wash. Go
Yeah.
put all the linens, your bed sheets, your pillowcases through another full hot rinse.
Yeah.
So also makeup use sparingly. A lot of times when I was interviewing in Europe, these beautiful skin ladies were saying they use very little makeup. Definitely don't use BB cream if you're breaking out. That's
Yeah.
not something that
Yeah.
you can use. We also want to make sure it's mineral based.
Yeah.
And watch our diet. Peanut butter is the worst to make us break out. Low dairy, low sugar. We want to increase our vitamin A. Vitamin A, if you're over oily, usually means that you're lacking vitamin A. So carrots is a great way to reduce sebum.
Okay,
Yeah.
good to know.
Also turmeric is a great way to
Yeah.
add it to our diet. So it's an anti-inflammatory, antiseptic, it's antimicrobial. So turmeric is a great one to add into your diet. And also just becoming more of an alkaline diet. So lentils, spinach, kale, like
Yeah.
just get into
Deep
tuna,
greens
oatmeal,
too,
like
yeah.
really more of an alkaline diet.
Yeah.
If you're breaking out, it means that usually your internal chemistry is too acidic. A couple treatments recommended would be lead light therapy.
Yeah,
Helps
that was
cut
huge.
the bacteria,
Yeah.
but I know you've had a lot of that.
Yeah.
The lead light is fantastic, and also coming for regular facials. It is a detox for your face. so
It is.
that
I
really
would come
will-
for my extraction facials once a month when I first started seeing you, at least. Like I was always there.
Yeah.
Yeah, and they helped a lot,
Yeah.
especially for the, what are they called? They're kind of like pimples, but the only way you can get rid of them is by getting them extracted.
Yeah, they're amylii.
Yeah, that's what it is.
So amylii is
Yeah.
just really a calcification underneath the skin.
Yeah.
And so we can remove those as
Yeah,
well.
and sometimes that's caused by too thick of a cream moisturizer. Yeah.
So we'll see a lot of people with their nighttime regime, a nice thick night cream, they'll bring it up under the eyes, and so we see a lot of amylii usually around the eyes.
Yeah.
And so we need an eye cream for eyes,
Yeah.
and we need a skincare cream for skin.
Next question is, how often should I be exfoliating? That's a great question.
Yeah, so lots of people ask that. We don't want to over exfoliate. The exfoliant polish that we have is one of their #1 selling products at Zoe, and it has magnesium crystals. So every time you do it, it almost is like a mini microdermabrasion. So we have to be careful that we're not over scrubbing our skin. So if you've got a sensitive skin, and acne prone, I recommend once a week. If you've got more of a moderate, skin, not too many issues, we can do it up to twice a week.
Twice a week?
Yeah.
Yeah.
And when you're scrubbing it, don't really press too deep. We almost want to put a little bit of a cleanser
Gentle.
in there and do a nice light, so it's not doing any skin damage as well.
Yeah, yeah, I use the same thing, the Zoe exfoliating polish, and then I'll use my sulfur mask after, and when I take it off, my skin glows immediately. Like, it's crazy how much of a difference you notice just after one use. So, okay, next question. What do you do for oily skin that won't go away?
Okay, so oily skin, again, it's a little bit more complicated. If you don't have acne or breakouts, you need to consider yourself extremely lucky because you are going to age just beautifully. You're going to have less wrinkles. as you age. So consider yourself lucky. It is kind of the newest trend to be actually that fresh, dewy look. So if you're actually not breaking out, you're gonna have beautiful, beautiful skin once we get this under control. But to control the oil, we really want to make sure that we're using cold water. We're not over cleansing. Again, sometimes if you over cleanse night and day, that you're tricking the body that it's dry, so it'll actually produce more oil. So we also want to use a retinol. Probably heard that. This time of the year, September, I like to have people hold off on the retinol, June, July, August. It can sensitize the skin. It is a bit of a controversy. Some people continue with the retinol. I just prefer my clients to just take a bit of a break. It's kind
During the summer months?
During the summer months.
Okay.
It's like a shampoo. Just when you go back to your skin, just responds much better. But using the retinol actually decreases the oil production, and it just, it just creates less oil. So it's a really great product. We want to use a clay mask. It actually will mattify the skin and absorbs the oil. So the clay is great with that if you have an oily skin. Glycolic acid is the powerhouse of ingredients, and for oily skin, it's usually in your toner. So definitely do not miss the toner.
Okay.
A lot of people, when they come in, they're missing kind of that part of the regime. So I tell people, don't miss the toner. Toner is very, very important for oily skin. Also, salicylic acid, it gets into the pores. Its job is to go into the pores, basically clean out the sebaceous oil.
And the complexion pads, the acne treatment pads have that in it, right?
Yeah. So that's the job of the salicylic acid. It actually sucks out the oil out of those pores and it clears it up. So we also want to increase our diet is a big thing, right? Using really great like green leafy vitamins, castor oil is good. Like we just want to increase the nutrition from the inside as well. We've talked about it that as well as decreasing sugar and dairy and stuff like that. But increasing your vitamin A, as lack of vitamin A can actually increase your oil. So carrots and stuff like that.
Yeah, I know like people say skincare or like having good skin is not just one thing. It's diet, exercise, good skincare treatments, good skincare products. There's so much that goes into it that it takes time, but it's worth it.
Well,
it's so nice not having to like wear makeup every day and all that stuff. Like,
it's complicated, and we're gonna go on a journey. You and I have been on a journey for quite a long time, and you know what? I think,
and we're still on it.
and we will be on it for the rest of our lives, right? So I tell people, I'm gonna give you the tools. Literally, I've got the tools for you, the lancets and the exfoliating tools, and also the magnification mirrors and the extractors, all that. We need those tools to actually do things properly so that we're not just coming to a place to have it done. We need to continue this journey ourselves. But so it's been great.
It has. Okay, next question. I'm curious to know about the price of treatments you receive. That varies, so I'll kind of let Suzette take that one from here.
Yeah, so again, we like to do our free skin consultations, and so we sometimes set up half an hour with you, and we're going to ask you exactly what your problems and concerns are, and then I'm going to see with my magnification glasses what I see, what I recommend. So again, it's about me directing you into what is going to be the best for you. It is somewhat complicated. It's not about just sometimes a one-stop shop. There's not one treatment that's going to take care of everything. So we want to make sure that people know that you might have to start with a simple facial. Then we move on to dermaplaning. Then we move on to microneedling to get rid of the scarring. Then we move on to lasers. So it does take time. Pricing can vary because everybody is different. What I can say to you is that we do a lot of events. Every 6 weeks we're doing events, and every time we do an event, there's definitely price reductions. So.
But that's why I would really recommend booking a consultation. And like I started just doing extraction facials for a really long time, and that's all we did. And then we kind of examined my skin from there and see what to do next. But that's such a we can't. That's a tough one to answer because it varies so much depending on what you need because everybody's skin is so different. So I would highly recommend booking consultation, and then who knows.
Well, and we also keep our prices on the website if you want to have a look at the website. They're definitely there, and again, by the consultations, we know how many treatments you're going to be doing. Some people need to do 3 treatments. Some people, and I get clients that are 60, 70 years old, sometimes they need to do 6 treatments. So,
like I know for me with because my scarring is so deep and so intense, I personally need quite a few more treatments than most people, but then there's a lot of people here, they just only have a couple, and they're good to go. Question. This is a good one because everybody loves not having to wear makeup, and I even personally have had that question where, like how do you not get down on yourself with like bad skin and going out in public and dealing with it? So, you know, not having to wear makeup and feeling confident, because people sometimes have said, no, I still feel confident, you know, having acne, not wearing makeup. I wasn't that way. I've cried, you know, it sucks. So yeah, the best treatment is to start with your skin to get that glowing, no makeup look. I'm even intrigued about this one still.
So, you know, when you walk by somebody and they glow.
Yeah.
They're just got that look, their skin is beautiful. And
Yeah.
It's like, oh, okay, so what do you do?
Yeah.
What I can guarantee is that they are doing three things. Every time I ask people, and I've asked thousands of women, what do you do with your skin? I can tell you right now, they are 100% usually using a retinol. It helps with the cell turnover, it helps decrease wrinkles, it fades scars, it evens out the skin tone, and it helps with the cell turnover.
Yeah.
Okay, so we're helping that cell turnover, we're getting rid of the dead skin cells. Usually they are doing a facial, right? Either they're doing the facial or we're doing the facial. And within that facial, we always add the lead light, so the lead light builds collagen elastin. But within that facial, they are doing exfoliating. Exfoliating, again, is a very important part of weekly regimes to lift those dead skin cells, and so that your skin is left smooth.
And
so when you
breathe too, it's not hiding underneath all that dead skin.
That's exactly, because there's layers and layers of dead skin.
Yeah.
So now we would have put the products, the serums on, it's sitting right on that baby smooth skin.
Yeah.
And it's penetrating and it's just working so much
Yeah.
better. And the third thing that normally people are doing, they're doing chemical peels. Chemical peels are usually suggested 2 to 3 times a year, especially this time of the year, the fall time. So we have a lot of dry skin build up again. So with the retinol, we've started now. With the exfoliating, we're taking that off. And the chemical peel goes to another layer that we can't, even if you do the exfoliation, the chemical peel goes to another layer of treatment.
I've never had one of those.
Yeah, so really important to be doing that. A lot of people actually say the chemical peel will help with their acne. So it actually gets down to those pockets of the oil glands, starts clearing those out, correcting those. So again, at this time of the year, great procedure to have. It preps the skin for any laser treatment, IPLs. So it's, again, shedding the dead skin cells on a chemical level. And then when you go to do a fancier treatment, say your IPL, your laser 1540, it just works that much better. So those are the three things that every time I ask somebody, it's like, I am truly using retinol, I'm exfoliating, and I've done chemical peels.
And probably using cold water.
And 100%
Definitely
cold
using cold water.
Yeah. So, and that's the other thing, going through Europe, I mean, it was like consensus when I asked over 40, 50 women that it was like using cold water, a regular skin regime, their Mediterranean diet.
Yeah, that's the thing, it's food, the food out there is so fresh and they eat so fresh, it's so good.
Yeah, it's low sugar, it's low fat, it's low meat, high fish, you know, a lot of your vitamin A's, so your olive oil, your olives, your vegetables. And so many people said that their skin was beautiful because of their diet, their Mediterranean diet.
Yeah, I noticed being out there, my skin is way better.
Yeah.
Okay, so the last two questions were kind of more, one girl asked, the biggest change in your skincare routine and diet since going to Kelowna Medical Aesthetics. Well, like I said, and I showed you guys the picture, I'll show it again, the before and after. It's been night and day. So the biggest change is definitely, so for my skincare regime, I'm using all Zoe now, like I said, using the cold water, using toner. I never understood how important toner was since I started seeing Suzette. And even sometimes if I am getting one, if I don't use a sulfur mask, I'll dab toner on it. And then I'll put my daily Power Defense Zoe cream. And then at night, I use the Growth Factor serum. And I absolutely love the Growth Factor serum. So that was a big one. And then just being consistent with it, because you can't just use something for 3 weeks and be like, oh, it's not working, or oh, this isn't doing anything. It took a lot of time. I started with getting extraction and facials all the time. I'm still getting them. Doing my microneedling and PRP, that helped tremendously, and now we're moving on to laser. So my skin before was just so dull, and it just looked kind of dead. It didn't have any life to it. So doing the laser and the microneedling, that has definitely brought my skin back to life. The dermaplaning, so that I wasn't getting that cystic acne. Like I said, there's so many things to it that it's great to come in, book a free consultation, chat with Suzette, and see what's going to be best for you. For me, I kind of needed a little bit of everything because my skin was very problematic. Like probably one of the worst you've seen, like at least in the top ones, eh?
No comment.
Yeah, like it was
No.
really bad. It was.
I'm just happy. I'm happy you're happy. happy.
Oh,
'cause
I'm
it's
so happy. Like
Yeah.
it's crazy, and that's why, you know, like so many people do struggle with skin. So I wanted to be obviously as open as possible with you guys that it does, like a lot of people struggle with skin issues, and it is what it is, unfortunately. But
Well, and my job is to make sure I build your confidence, to say,
Yeah.
you know what, we're gonna correct this. It's
Yeah.
gonna take time, but I'm gonna help you. I'll be there every step of the way, asking
Yeah.
you exactly from the time you wake up to the time you go to bed, what are you doing?
yeah,
What I can teach you
Mhm.
and give you the
Yeah.
tools to learn this yourself. And
Yeah.
just, we're gonna correct this.
Yeah.
It just takes a bit of time.
yeah, it does. And diet is also another huge thing. Like Suzette said, it's not just one thing. There's everything. So, you know, cutting out dairy and sugar and even a lot of like gluten, like processed bread and stuff doesn't sit well in me. And even eggs now, I can't really eat eggs because I don't know, they just don't sit well in my stomach
Yeah.
or with my skin. And then vitamin A,
Yeah.
that's one. I'm taking zinc, you know, your omegas, vitamin C, like, so taking all of this stuff and making sure, you know, I'm having my kale smoothie with only half a fruit, like not too much sugar.
No
And
sugar.
yeah, so there's
Yeah.
that has helped a lot too,
Yeah.
I've noticed.
Well, the medical facials are a great way to start. We actually test your saliva to see if your
right, I forgot to
pH
do
balance
that. Yeah,
is too acidic or
Mhm.
if it's alkaline, right? So then I kind of know where to direct that.
Yeah.
If it is your internal chemistry or if it's the products you're using, the
Yeah.
external, right? So it can also be a combination of both.
Yeah,
But at least we kind of know,
yeah,
you know,
yeah.
where we're at with that.
Yeah, and even like starting, for a lot of people love coffee, starting your morning with a celery juice or a green juice and then some water and lemon and then having your coffee later. Coffee should be a treat. You always
Yeah.
say that.
Yeah,
Should
it
not be
should.
your first thing you go to in the morning. So
No, because we wake up dehydrated.
Yeah.
We wake up with, we need nutrition
yeah,
and we need hydration.
your
So
body
let's
is
start
so
off.
dehydrated.
Let's start with some water and put a little bit of lemon in that,
Yeah.
and then get into your smoothie, and then, like I said,
Yeah.
use your coffee as a treat.
Yeah, because I do love having a coffee, but that was a big one. I noticed my skin started getting really bad a couple years ago when I was first thing waking up, having coffee and I wasn't hydrating my body. And I even noticed too, I get bags under my eyes super easily if I'm not staying hydrated. So
Yeah.
your body, once you kind of start to find it and you kind of get to that peak of feeling good and you know what your body's used to, I can tell immediately when I have something that my body is like, no, like
Too
I said, eggs,
acid.
just I can't do it. And then also my daily skincare routine. I kind of touched on it a little bit, so I use everything Zoe. I use in the morning, I just do cold water, toner, and then their daily power defense. I also mix it in with the Zoe SPF, so I'll do half and half because it acts as a primer
Mhm.
as well for
It sure
makeup and
does.
has a little bit of tint in it, so sometimes that's all I'll use for makeup, and it's fabulous because I've tried many different brands of SPF lotion and it's clogged my pores where this one doesn't.
And it can make you break out.
Yeah,
And even the glow minerals we use, that
Yeah.
has a 20 block in there, and actually
Oh,
is
I
mineral
didn't
based
know
and it
that.
calms things down too. So
Yeah.
be careful with your makeup too.
yeah,
Right?
yeah. So that's morning, and then evening I will do cleanser, toner, and then I actually use my, what's the one in the
The
green?
growth- the
The
growth
growth
factor,
factor serum. Yeah, I use the growth factor serum, and then once a week I will use the exfoliating polish and then the sulfur mask.
Yeah.
So I swear by all of their products. They are phenomenal, phenomenal, phenomenal. Yeah, if you guys haven't tried them, you guys do samples, don't you?
We do samples.
Yeah, so you guys can do little samples. Zoe also has really great kits that you guys sell too, where you kind of get, for a really good price, you kind of get a couple months worth of each product, so then you don't have to go in and buy everything, all the big ones right at once. So that's really great too.
Yes, they're
Yeah.
very reasonable, so.
Yeah, yeah. Okay, awesome. Well, thank you guys so much for tuning in. Thank you, Suzette,
Thank
for
you.
joining us and answering all of our skincare questions. We will probably be doing another one of these maybe in the new year because I know tons of questions always come up. So make sure you guys give Kelowna Medical Aesthetics a follow. Her handle is again right there for you, and then also her website. And yeah, if you're interested, always just book in for a consultation and you guys can kind of start taking the steps to get some nice and healthy skin. So yeah, like I said, we started with a lot of the extraction facials, still doing them, still getting the LED light. We did the microneedling and the PRP for probably 4 or 5 sessions, I think. But since I do have super deep ice pick scarring is what they're called, we're gonna be using their brand new laser system that they got in. It's top of the line, super fancy, high end, and it's half the treatments of most lasers, correct?
Yeah, it's the new 2019 icon from Sasher.
Yeah.
And we'll be using the 1540 on you. So we've can now go to the deeper layers for the Pixar. We've kind of done with the microneedling PRP, the superficial stuff.
Yeah, which
now
has
we're
still
gonna
helped
go
a lot. But yeah,
to
now
the
we're gonna
deeper
go to the next level.
Yeah, and it's the
Go
FD,
deeper.
so the F deep 1540.
Oh.
So there's two parts, so we'll explain, but we'll be taking you behind the scenes and doing the treatment on Jordan and get to show you.
And then you guys can kind of see, how it is. We get numbing cream on, it doesn't hurt at all, so it's super nice. And it has it just feels cool. Yeah, it feels cool and warm. I don't know. Anyway, so we'll take you guys behind the scenes so you can kind of see what it looks like.
So we're gonna bring you behind the scenes and show you this treatment. And she's gonna be very honest on the pain, the downtime, and all of that. You're going to see everything today. So enjoy. Okay, so we've just done her lower segment here. Doesn't that feel nice? So we're just using an ice roller just to kind of calm down. So this is normal. We've increased the levels like we said, so she's going to be red, swollen for today, but heals very quickly. What do you have in your hands, Jordan?
I have my nurse Suzette to squeeze, and then just a heart. This is Suzette.
Well, her head's still attached, so that's good. Okay, now we're going to continue on to do her forehead. Okay. So we are done. We've just finished rolling her whole face with the cool roller, and I've actually applied 100% organic aloe gel and growth factors, our plant-based growth factors, to heal and calm things down. So how are you feeling?
Good. It's definitely warm. Here, I'll get a little closer for you guys to see. But yeah, my face is warm, obviously red. But yeah, I feel fine. Yeah, it's just warm.
Yeah, and I think what we have to remember, which I tell people, is that this is a treatment. This isn't a fancy little fluffy facial, or dermaplaning downtime is maybe half an hour. This is actually a full-on treatment. Jordan experienced some very deep pick scarring, and my before and after pictures are actually unbelievable from the first treatment to the second treatment. So I can't wait till she returns in December to reshoot her pictures, because it's unbelievable, the changes already. So we actually increased the levels today, so she is a bit red for sure. She, in a pain of 0 to 10, 10 being quite painful. Where were you at with this treatment?
It varied from a 1, which is very low, to a 4. So there was a couple spots where I could definitely feel a lot more, but overall the numbing cream helps so much. So
And we
it
used
wasn't too bad. It was just warm, and then it was just like a little prick.
So very tolerable, right?
Yeah.
So we got deeper stuff. We need to go bigger, better treatments. And the 1540 laser with the FD, the after deep, definitely is what Jordan needed. And she, when she returns at Christmas time, we will do her third treatment, and then that should be it for her.
I'm so excited.
Yes. So, anyways, thank you for joining us in the back scenes.
Thank you guys.
Thank you, Jordan.
Thank you. And then I will do an update on this one over the next few days on my Instagram under my skin section, which I know a lot of you guys know